Hey everybody, it's Dr. Friels again here. We are with a young lady who is a type 2 diabetic, and unfortunately she has undergone an amputation of the toe. When is the last time you saw a podiatrist? It's okay. They're not.
More than 6 months ago.
More than 6 months ago. So unfortunately we're to the point where we've got some blood blisters, we've got a lot of callousing, so we're going to get everything cleaned up. We're going to drain the blood blisters. She has fantastic circulation, so I'm not really concerned about you healing the wound. Of course, being a diabetic, that you are immunocompromised, so we've got to watch these very closely. But we want to get all the drainage out, and then of course I told you about the iodine, to use that. And that's how we're going to treat the wound. So we'll walk through it together if you want to kind of take a peek. I already started trimming this callus here. It's quite thick. You can see this cap here was trimmed off first, and we've already discussed how we can prevent this in the future. One of the things that we're going to do is a minimally invasive surgical procedure that we do here, which is basically clipping the toe underneath. If you want more information about that, you can watch, that's hard right there. You can watch our video that we already have on YouTube and Facebook. It's called a hammer toe release or correction or something. It's a really good video and a step-by-step process and how that is. So as you can see, hers is reducible. These are little guys, like it's like paring a rock. These are hard. And she can't feel a thing, which is good. And sometimes when they're this hard, what we can do is put a little saline on there and get the tissue nice and soft if we need to. So there's probably going to be some areas I may have to do that too, but let me see. There we go. And you just wear a regular tennis shoe?
Right.
You know, often when we do an amputation, we will do a toe fill, which is basically an insert, and do this part, fill this part of the toe. So the foot still feels that that part of the toe is there, because what's happening is she's getting these hammer toes because of the toes around it is compensating. Plus we talked about your higher arch. Wish you guys knew this is really tough skin. So it's only been 6 months. So this tells me you need to be seen monthly to trim these calluses. But again, the goal of doing the procedure is to hopefully prevent it from building up. And if you do get a slight buildup, then it's going to be not as severe. Do you have any questions for me while we're kind of whittling away here? This is going to take a few minutes. No, pretty good to go? Oh, you got it.
Yeah, I'm good.
Okay. Yeah, there we go. Looking much better. And you can see all these little spots here. It's actually dried blood from pressure. And so that's how calluses form. The pressure in whatever area, if it's on the bottom of your foot, if it's on the tip of your toe from hammer toes, creates bleeding underneath the skin. So a lot of people when they see this are like, is that a wart? What is that? That's actually bleeding from the pressure. So we know we really need to get the pressure off of there. Okay, so trim over here on this toe.
I'm just gonna move this way. There we go.
Good view. All right. Get all this off. Now you're a type 2 diabetic.
Yes.
You're quite young. How did you end up being a type 2 at such a young age?
Well, yeah, I had extremely high triglycerides.
Okay.
They would be like 5,600.
Oh my God.
It got to where I was having to be put in the hospital like twice a month with pancreatitis. And
wow.
Once I got the pancreatitis the first time, then I became a diabetic.
Gotcha.
And last year, I had weight loss surgery.
You look great.
Do you want a handle?
Huh?
Do you want a blade
I
handle?
might want a blade handle.
Okay.
I'm not gonna lie, my hand's starting to cramp up a little bit. Okay, so we're back. Got a nice blade handle. Take some pressure off of the tip of my finger. We were just discussing, before we started filming, I was checking her range of motion, and she actually has something called equinus, or equine, like a horse. When I tell people, especially in Kentucky, I'm like, you walk like a horse. Everyone gets it around here. You know, the point is you're putting too much pressure to the ball of your foot, and as you can see, these toes are just developing all these callousing formations because of all the shift of the weight there. This one's actually going to open up a little bit next to this little blood blister here. Right in there. The good news is we're catching it before it's too deep. And so we can get all this cleaned up, because any of this dead skin will break underneath. Once that skin breaks, you get that hard callus over top, and then it ulcerates. And then that's when we run into problems. That ulcer will, let's see here, this is just, it's soft. The ulcer, of course, can get infected, and then the bone can get infected.
And then you wind up with half a toe.
And then you wind up with half a toe. At least you're in good spirits about it. I'm sure at the time it was pretty traumatic.
No, I had asked and couldn't get anything done, and I had finally just asked my primary care doctor, because I happened to be in the hospital at the time, and I was just like, can you see what's going on with my toe?
Right.
And he took me down for an x-ray and came back and told me what it was, and I was just like, take the whole thing.
Right. You don't. She had osteomyelitis, which is a bone infection. I'm really happy to report, everybody, that after taking this blood blister, the cap off, that the skin underneath is very healthy. It looks good. Also, we already discussed your good blood flow. So that's so important to heal something like this. I will tell any students or residents that are watching, if you, or potential patients, if you go to trim and do some own surgery on your own at home and you do not have blood flow, you are creating many, many more problems. You never want to do that, because you are making the wound bigger. You're not helping it. So don't get any blades out at home. If you don't have good blood flow, look here, look at that skin. That's good. Look at that. Let's just get all the gunk off. Yeah, much better. I'm really looking at this part right here. See that? Make sure that's not getting into the next layer of skin. And the toes are kind of hard to trim because they're so small. You know, and you got to kind of take your time, whittle around it. You don't want to make any big slices, even though this callus is godly, probably feel like an inch thick. But, I mean, look at the tray here. Look at everything we've gotten so far. Okay, that looks good. Got this one little piece. I'm a perfectionist, so I want everything to be just right. Okay, let's look at the bottom here. Can you touch up just a little bit? Let's save the back a little bit. We've got a little bit, not bad. I'm probably gonna have you grab me another blade before we move on to the next foot.
Sure.
So we were discussing before we started filming that one of the big things we want to do, like I said, is stretch. Every day she's going to spend about 15 to 20 minutes, and we have a link on our website for those of you at home that want to start stretching, because we absolutely have to get the pressure off of the ball of the foot. That's why you see a lot of people that have ulcers in this particular area here. This is underneath the big toe joint. All right, I'm going to let you grab that blade for me. Yep. I'll take the other foot now. All right. I don't use these enough. They're kind of hard to get on. Okay. Okay, where do we want to start? Let's start here. So she's going to be using stretching splints, or a night splint, every day. Ideally wear as much as you can. Some people sleep in them. Others wear them whenever they're sitting down watching TV for a few hours. But the more you wear it, the better. What that's going to do is give you a constant stretch on the Achilles tendon to help alleviate some of the pressure here. When I was doing a lot of foot surgery for wound care when I was in Atlanta, we always did a release of the Achilles tendon to get the pressure off of the ball of the foot. That's how common it is to get pressure in these areas, and to also have a tight heel cord. So that's essential in kind of changing the mechanics of how the foot functions to get the weight off of it. Okay, you don't go barefoot, do you? Okay, thank God. Okay, so not only are we gonna do that to really kind of change her gait and get her more heel to toe, we are also going to do a mold of her foot today to make a custom orthotic. And what I'm going to do is offload these areas that are pressure points. Sorry, Kaylin.
It's okay.
Get out of my way. All right, we got this callus over here too. So make sure you document that. I didn't tell you about that one.
Okay.
It's a surprise callus. Okay, so this is the sub-fifth metatarsal head. So you kind of function as a tripod. You put a lot of pressure and weight to your heel, of course, and then this head of the bone, and then this head of the bone. So what I'm gonna do is just some rebalancing with your orthotics so you use all 5 metatarsal bones evenly. Well, I'm definitely getting my workout today here. So if anybody has any questions about their family, friends, or themselves, like in regards to diabetes, callousing, blood blisters, you name it, just drop a comment. This little guy's hard to get to. And I'm happy to respond back. If you guys want to see any videos, just let me know. We do this stuff all day long, so it's just kind of our normal day. But if you like it and you want to see more, just let us know what you want to see. Also, don't forget to sign up for our channel so you get alerts every time we get to whittle away or see something neat. We have a hookworm video. Yeah. This patient had gone to, oh gosh, what was it? St. Lucia or some island, island in the Caribbean, and had been playing a lot of volleyball on the beach. And barefoot, of course. I mean, who goes to the beach and wears shoes? And a hookworm had gotten in his foot. By the time I got him, it was bad. It was tunneling everywhere. So that's a pretty neat video for you guys to watch if you like this stuff. Also, we have another one with gout that was just oozing all these crystals, and it was pretty neat. It's kind of actually how all this got started. Okay. Skin, you can see, I mean, I don't even know how much dead skin we've got down here. I'd probably be a good wood maker.
Yeah.
You have to go so slow because you don't want to slip and cut the toe next to it because everything's so close. We're getting there though. So like I said, you're going to put some betadine or iodine, whatever you've got at home. It's available everywhere. And you're going to paint it on the area where the blood blisters are, and then cover it with some gauze every day. And you're going to come back in 2 weeks so we can kind of take a peek to make sure everything's healed. I think you're going to be just fine, but you will please call us with any concerns in the meantime. Mm-hmm. Just to let you know, also diabetics have first priority coming in. We have 4 providers here. Someone can get you in same day for any concerns for signs of infection, such as redness, drainage. What's going on here? Here we go. Something, a little pressure. That just came out, didn't it? There we go. Okay, so you're getting some, what appears to be, I don't know if this is Almost looks like some purulent drainage, but there's no odor. This is typically a sign of infection. Let's get in here a little more. Whatever's in there, we want it to come out, because the last thing you want that to do is sit in there. Fluid continue to damage the skin underneath the blistering. Yeah, this is just dead stuff. Let's check out this a little more here. Okay, everything's cleaning up. Looking good, looking good. Just a little old fluid. You've got a small wound on the tip of this area, but not bad at all. Okay. This little top right here, and I think we're pretty much done. Okay, so let's do some betadine here and then over here. Much better.
Yeah.
All right, everybody. Thanks for watching another episode of a 2 drainage of blood blisters. And I don't even know how many calluses. I've completely lost count. Everything's been cleaned up and she is ready to go. We're just going to get her wrapped up and get her out of here. Thanks for watching, everybody. I'll see you next time.